So one of the most common treatments for dry eyes is preservative-free artificial tears. Preservative-free artificial tears look a little bit like this. They come in individual vials that are typically only for one-time use, as opposed to the typical eye drops on the market. They come in a full bottle that look like this. Preservative-free artificial tears will help prevent any symptoms of eye irritation and dry eyes if you use them consistently, maybe about 3 to 4 times a day. Now, the fact that preservative-free artificial tears do not have preservatives in them will help prevent any eye irritation from frequent use, as compared to your typical eye drop, which does have preservatives in them. Using these frequently can lead to eye irritation from the preservatives in them. On top of using artificial tears, doing warm compresses is another very effective way to help with dry eye symptoms. A warm compress is typically an eyelid mask. It can be a microwavable one or an electronic one that is heated, and you place it right on top of your eyelids for about 10 to 15 minutes. And what this does is it will help melt all of the oils inside of the eyes and help them come out from the glands to help properly lubricate the front surface. Omega-3 supplements are another option to help with dry eye symptoms. Omega-3 fatty acids are important for helping to produce very good quality tears, especially the oil film that is present in everybody's tears. A diet rich in omega-3 fatty acids, either through supplements, normal fish oil, flaxseeds, or walnuts, can be effective in producing better quality tears. Another option to treat maybe a little bit more severe dry eyes is using a medicated eye drop. These eye drops are cyclosporine eye drops that help decrease inflammation and increase aqueous production for your tears. Now, these cannot be purchased over the counter, and you'll need a prescription from your eye doctor to use these drops. Punctal plugs are another effective option to help treat dry eyes, and the way these work is they are tiny little silicone caps that are placed into your tear ducts, which are located right in the bottom inner corner of your eyelids or the upper inner corner of your eyelids. And how these work is they will prevent your tears from draining out of your eyes very quickly, therefore leading to relief from any dryness of the eyes and just keeping your eyes lubricated for a longer period of time. Let me know if you've ever tried any of those options below and what has worked best for you.